So we continue our last lecture with the part about the instability possibilities in different formulations. Actually, still will be studied in more details later on in dosage form design, but we have a touch of the subject. Okay. So when it comes to oral solutions, means solutions for oral administration, some instability problems will happen like loss of flavor. Usually oral solutions are flavored. There is some, like you see some solutions for oral administration have maybe sweetened, may have flavors of different fruits like orange, strawberry, and so on. So flavor may be lost. The taste may change on time with storage. Maybe you have some the bad taste or different taste. We call it off flavors. And this taste may come from the plastic bottle containing the solution. So it may result from interaction with the plastic bottle. These solutions may have some dyes to give them favorable colors. There may be loss of dye with storage. Precipitation of excipients or active ingredient may happen with storage and may have some discoloration. The effect will be change in the smell or taste or feel, okay, or appearance if we talk about color change in appearance. So how to prevent such instability? We should use proper excipients and suitable packaging materials. And how to know that these excipients are suitable or no, they interact or no. As we explained before, the use of stress studies or forced degradation studies. So once we store, we will, at the beginning, you may have 5 or 6 or 7 excipients in mind. All can be used with your active ingredient. So you store your active ingredient with each excipient separately. You expose it to stress study and then you see if there is interaction between them or no. And at the end, excipients that don't show any interaction means they are compatible. They don't have incompatibility, means they have compatibility with the drug, then they can be used. In solutions for parenteral administration like IV intramuscular injections, there may happen some same concept. There may be some interaction with the container. There may be interaction with the excipients or degradation, so change in chemical composition. This may result in some physical changes and may also, you may have some physical changes like discoloration, presence of precipitate, or presence of whiskers if some small pinholes are present in the ampoule due to improper sealing. The solution wicks out. The liquid evaporates and the solid settles on the outside. So they help all. It further helps also in wicking out more solution, and long lines of crystals will form on the outside. So usually the ampoule is usually you see the ampoule like this. Oh, difficult to draw. Okay. Um, Usually this upper part of the ampoule is there will be longer before filling, and then the ampoule will be filled, and then this upper part will be sealed. So will be sold. Okay, we sealed also will be sealed. Okay, so if the sealing is not efficient, not closed completely, then it will have a small hole, maybe that will very small pinhole that may leak some of the products. There may be some clouds, means cloudy appearance of the solution. Instead of clear solution, it will have maybe there is some precipitate or something, very fine precipitate that make the appearance looks cloudy. So it will occur due to chemical changes. For example, polysorbates in the solution may form an acid which is poorly soluble. Solubility product may be exceeded. There may be some precipitation, and then original preparation of the supersaturated solution or the use of metastable form like calcium glucitate. So supersaturated solutions may tend to, with time, that the extra amount that is dissolved will start to precipitate on time. Okay, so the result will be change in appearance, and they may affect also the bioavailability of the drug. Prevention of instability by the use of antioxidants that prevent oxidation reactions that may cause formation of products that will change the appearance, or oxidation of the active ingredient itself that result in loss of potency. There are many antioxidants that can be used, like acetylcysteine, ascorbic acid, vitamin E also can be used. There are many types of antioxidants. Some of them are water soluble, some are fat soluble. So water soluble ones will be used for aqueous solutions, fat soluble ones will be used for oily solutions, okay, or solutions in oil. Heavy metals also will accelerate degradation and will facilitate oxidation reactions. So there should be chelating agents like sodium edetate. Chelating agents will bind to the heavy metals and they prevent oxidation and the subsequent discoloration. Okay. If the stopper or material of the container also interact with the product, then should use different material. We should check the manufacturing process if there is any step that cause decomposition of the ingredients. And then to prevent this supersaturation and precipitation, we should use some co-solvents like propylene glycol or polyethylene glycol. And propylene glycol, ethanol, and glycerine are used commonly. Usually they increase the water solubility of substances that have low water solubility, and they prevent their precipitation. Okay, if this is not possible, then we can use emulsions, and we use micellar approach. Okay, we can use salts of the active ingredients, some active ingredients that are not soluble in water, like ciprofloxacin, for example. Their HCl salt, ciprofloxacin HCl, is water soluble. So if you want to make liquid preparation, then we can use ciprofloxacin HCl. Okay. Suspensions are normally, the active ingredient is not soluble in the aqueous medium, but the most important for suspension is that it can be resuspended upon shaking. So if you shake the suspension and then you can resuspend the contents again, then you don't have any problem. But if there are some changes, and also after you suspend it, it should not precipitate quickly. So it will be suspended for time enough for you to measure the dose and take the required dose. Okay. So this instability will occur with the changes in particle diameter. For example, if there is increase in particles size with time, then they will precipitate quickly. And then if there is change in the concentration of resuspending agent, Also, there may be some problems for they prevent the flocculation or sticking of particles together. So once you shake, you can resuspend them again easily. So in this case, if there is decay or decrease in its concentration, not working anymore, and then if the particles flocculated, they form what we call cake. So it will form a cake at the bottom of the glass. You shake, they are solid, that will not be resuspended easily with shaking. There may be some changes of viscosity of the media, of the suspend in the aqueous medium itself. So a part of one of the ingredients in the formulation of suspensions is we can add the thickening agent. So thickening agent, we call it suspending agent, that will help to make the liquid or the suspending medium thick. So it will slow down the settling speed of the particles. So once you shake and you resuspend the particles, they will be slow to settle down. To be slow to settle down, you need to make them fine, and you need to make them the aqueous medium thick. Okay, so fine and then particles and then aqueous medium thick. They will not precipitate quickly. Factors like temperature, pH of the medium, and presence of or microbial growth also, they may make some changes and cause instability in the suspension. So these are the problems like settling quickly, caking, crystal growth, the particles will become larger in size. Okay, there may be some loss of drug content uniformity in different doses from the bottle, and loss of elegance. Loss of drug content uniformity because once you suspend, then maybe the first you get once you suspend, the active ingredient particles will not be suspended uniformly and spread in all the aqueous medium. They may settle quickly, so the amount you take doesn't contain. You are prescribed to take, for example, 10 ml of this suspension. Suppose that once you shake and then you uniformly distribute the particles, this 10 ml should have a certain dose, like for example, say 100 milligram of the drug. But if it settles quickly, then you don't have this 10 milligram, you have less than 10 milligram. And then at the end of the bottle, you will have more particles, more concentrated particles. So once you shake and take the dose at the end of the bottle, you are taking higher than required. It contains more active ingredients. So here we don't have uniformity of dosing. Okay. Then how to prevent instability? It all depends on the formulation development and pre-formulation studies. When we say about, we will study this in details later on in dosage form design, BFD2. But when we talk about pre-formulation, then we study the characteristics of the active ingredient itself. What is the crystalline form? Is it amorphous or crystalline? Is it present in different crystalline forms? Is there any difference in solubility between them? What is the solubility of the active ingredient? How is the stability? How is the stability in different pH values? Okay, so many information about physical and chemical properties of the drug. What factors make it decompose easily? Acidic pH or alkaline pH, temperature. How is the photodegradation? Is it photosensitive or no? Moisture sensitive or no? And these things. And then we do the formulation development. We will do stress studies, and then stress studies, and then we expose it to high temperature in mixture with excipients. And then we can screen different excipients and see whether they interact with the drug and cause its degradation or no. So if you find from pre-formulation data that your drug, for example, is easily oxidized, then you have to use antioxidant in your formulation. It is light sensitive, so you have to use opaque packaging material, so light will not go into the product. Moisture sensitive, then you have to use impermeable packaging material that doesn't allow moisture to go in the product. And then you have to prepare it as dry mix, and only water will be added before the use, for example. Okay, and so on. So all depends on pre-formulation studies and the the compatibility studies during the formulation development. In emulsions, as we know, they are same like milk. You have an oil droplets. They are dispersed in aqueous medium, or maybe vice versa. Maybe water droplets dispersed in oil medium. So stability is mainly to keep the oil droplets same size, dispersed. They don't flocculate and make big globules or droplets that will separate, and then you will have separate phases again, water separate from oil. Okay. So instability occur maybe due to change in droplet diameter. Usually viscosity, when we increase the viscosity of the external diameter, then what happens is that there will be slow, what do you call it? Like you increase the stability in this case. You increase the stability of the emulsion. Okay. So emulsion is, you have aqueous medium, and then you have two phases. You have what we call it internal phase. They are small droplets. You may not be able to see them with the eye, but can be viewed under microscope. Okay. These droplets are circular. If it is oil in water emulsion, means this is the internal phase is oil and the surrounding phase is water. Okay. So to formulate them, we need to use surfactant. Surfactant is the material that will help to form the droplets, and they stabilize the emulsion. The problem for emulsion stability with time is that there may be some flocculation of these droplets. They accumulate, or there will be coalescence. They merge together, they form large droplets, and then they will float on the surface, and they make what we call it creaming, same like the cream in the milk. Okay, cream of the milk is will float on the surface. These are the fats that have been dispersed or emulsified in the water. They coalesce together, they merge together, the droplets, and then they float on the surface. They form a separate layer. We call it cream. So to stabilize the emulsion, the droplet diameter should not increase with time, should be stable. One of the factor that is can stabilize them also is increasing viscosity of the aqueous phase. This will slow down this movement of droplets or oil globules, and then stabilize them. Difference in density between water and oil, the higher the less stable. Increasing temperature will destabilize, increasing pH will destabilize. Microbial growth also may destabilize the emulsion. Since you have aqueous medium outside, then it is suitable for growth of microbes. So instability problems, we have creaming and we have cracking. So creaming, that here you have, they will merge and be on the surface. There will be some on the surface. Cracking, you will have two separate phases. The effect will be loss of drug content uniformity in different doses. Means that when you take 10 ml prescribed dose, for example, it may not have, there may be some flocculation also, like and so on. So you may not have you didn't take the same amount of active ingredient in each dose. How to prevent this instability? Again, by collecting enough information about the ingredient, the oil that we want to disperse or emulsify. And then depending on the pharmaceutical development studies that we do, stability study, we try different formulations. We study different factors that may affect the stability of the emulsion, and then we see which blend and which factors are the best. Okay, Like, for example, how much should be the appropriate viscosity, how much should be the appropriate pH. Do we need to add antioxidant, for example? There should be preservative also to prevent the growth of microbes and so on. Okay. Semisolids like ointments and suppositories, they may have some changes in particle size, and they may have some there may be some polymorphism. Like when we study the suppositories, we'll talk about cocoa butter. It is commonly used base for suppositories. Cocoa butter present in different crystalline forms. They have different physical properties, and they have a different melting point. So if you use inappropriate form, polymorphic form, or the processing you use high temperature, then you convert it to another form that have low melting point, so it cannot be stored at room temperature. Okay. There may be changing in consistency, means the hardness of this one may become hard than normal or become soft than normal. Drug release rate may change subsequently with the changes in these parameters. There may be some coalescence if you have emulsified emulsion base like creams, and there may be bleeding, means there will be a leak of the active ingredient from the ointment base. Okay, this is the bleeding, no blood, just the active ingredient will separate, or you mix some oily bases together, and then they will separate with time, so the liquid ones will bleed out. This is what we call it bleeding. Okay, so this will result in change in the performance and change in content uniformity and change in the elegance and the appearance as well. Okay, when we talk about performance, means drug release rate. How to prevent? Also, again, you have to study the stability of the product. You do pre-formulation study. You collect the appropriate information, the important information about your drug product and its characteristics, physical and chemical. And then you do formulation development. Usually in development, you test several formulations and you study their stability and their performance, and then you choose the most stable and best performing one. Okay. In tablets, there will be change in disintegration time, dissolution profile, hardness, appearance. Okay. So disintegration time, suppose that usually within 30 minutes, the tablet should disintegrate completely. It may become harder. It may not disintegrate on time when you put it in liquid, or it will come to the stomach. The drug should have certain dissolution profile, means certain amount of the drug should dissolve upon taking the tablets, or in the lab in vitro when we use a certain dissolution medium like water or HCl or certain buffer. They should achieve certain concentration dissolved in this medium within certain time. So there may be changes in this solution. They may become harder with time, or they may lose. Usually they become harder with time. Some tablets may become loose. They lose the hardness. They will absorb moisture due to some ingredients in them, and they will swallow and become soft. Okay? So the effect, they will change the product performance. They change the drug release, and they may change also physical properties. Some tablets may show color change, spotting, okay, swelling. There may be some physical changes even. So how to prevent instability? Again, by studying the active ingredient and by studying the formulation itself, and trying different formulations, studying effect of different factors on the formulation performance till we reach to the optimum formulation. Okay, and we confirm this also by conducting stability study that the product has the required characteristics during the shelf life. Capsules, they may have some change in appearance, same like tablets, dissolution profile may change, and the strength of the capsule itself. Capsules may be harder, and they can easily break with any pressure with time, especially with high temperature. There will be effect on the drug release. So this at the end will affect the performance the bioavailability of the drug, because bioavailability means to reach into the blood circulation. The drug to reach in blood circulation must dissolve in the GIT first, right? So if it didn't dissolve adequately, no adequate amounts will reach to the blood stream. So the change in the drug release will affect at the end the bioavailability of the drug. Same thing we prevented by choosing the appropriate formulation. Okay, so here by this we complete this lecture. Any question so far?